Welcome, everyone. Good evening. This is a Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM Fargo Moorhead, where we are adding local color to your airwaves here on KPPPLP radio. We are covering the pandemic. Every day we've been bringing you updates about what is happening with this pandemic and how it's affecting our world. Today's show will focus partially on a new order by President Trump suspending all immigration. What does that mean? Well, it means no more coming and going, no more visas, no more anything. No more immigration. So I'm going to talk a little bit about what's being said publicly and what's being done. And what's not being talked about publicly but is happening. It's caused me great alarm, especially for those Americans that are still abroad, that are still not home, that are still traveling or stuck in another country. There are literally thousands of Americans that cannot come home right now. My mother is one of them. So it is something that is very concerning, especially because, and this is my biggest fear, if we have this closure of our borders because of the pandemic, this could go on for months. This could go on until next year. And Americans will be shut out. Even Americans will be shut out of coming into our country. So we're going to talk about all of that today. I also want to thank everyone that has sent me content, questions, comments, and of course, your support. Duke, how can people follow us and support our work?
Well, thank you very much for joining us tonight. We've been faithfully putting these programs on at 7 o'clock Central Standard Time, Monday through Friday, and on the weekends we have Spanish shows, and sometimes we do cooking shows. Thank you for joining us, and thank you for supporting our work. You can find us in many different places. Facebook, obviously, because we're streaming there. FM 88.1 Fargo Moorhead Radio. Mexi-Can and the People's Press Project. You can find us on YouTube at the channel name is Duke1517. We're streaming on that channel too. And you can go to kpppfm.com and look at the shows we've done, and also go to the donate tab and make a tax-deductible donation to our station so we can continue the work we're doing. And also, if you'd like to give us a call and leave a message on our message line, the number is 701-566-0917. Again, that number is 701-566-0917, and thank you for everything you're doing. And also email Cindy at kpppfm.com and Duke at kpppfm.com.
Now, I haven't seen a lot of discussion in the news lately where we're interviewing doctors, we're getting updates from doctors, we're getting videos of emergency rooms, how the medical staff are holding together, whether or not they have the necessary PPE. And I want to say that I don't know if that's because we are overstimulated. We've got too much of that information, and people are simply overwhelmed, and they don't want to hear it anymore. If news stations aren't carrying it because they're trying to give people a break, I don't know what it is. I'm not sure what it is. But I'm here to tell you that our nursing, our medical staff, our medical workers, everyone that works in a medical facility, including the janitorial staff that sanitize everything and do this every single day. But I want you to know that they too are going through an incredible period of stress. They continue to go through an incredible period of stress. And as traumatized, as tired, as overwhelmed as we're feeling as citizens of our countries, they are feeling that as well. And on top of it, they have the daily stress of sickness and death, sickness and death, sickness and death. And at some point, as a country, as a world, we're going to have to grieve. We're going to have to assimilate what's happened. We're going to have to collectively come together and share that grief, because things are happening so quickly to us that we're not even able to process it. Does that make sense?
Yes, very much. And, it's good analysis, and I'm not sure what's going on either. And also, we live in such strange times, and the media, is isolated too. I mean, the newsrooms are empty. The TV stations have sent people home. There's still people that have to go into work and run cameras and run the technical aspects of broadcasting, putting themselves at risk, because every time any of us go anywhere and we mingle with other people and family members, we're potentially bringing this back. And I want to hear news every day. I'm not, it's because it's so important that we need to look for any progress being made, or also no progress being made, and get psychologically and emotionally prepared to be here for the long haul. We all wish it would just go away and things would go back to the way normal was, but we'll never see that normal for a long, long time, in my opinion.
Mm-hmm. And if you add to it underlying problems, we have a lot of people in our country that have underlying mental health issues, isolation, and all of the, pandemic anxiety.
Yeah.
It's exacerbating things.
And also, it's really difficult to get appointments these days. I mean, the counselors and different people are booked. I mean, you can call in here locally, call into a few places, and it's going to be July before they'll see you. And I'm like, July? See, April, May, June, 3 months, and imagine someone needing help right now, and they can't meet with a counselor, and they're going to do it virtually. They're really stepping up, and they're using, tele whatever they call them. They give them all different names. They all have different software they use.
Teleconference.
Yeah, so you can just phone it in, video it in. But
Zoom MD.
We need Zoom in MD. We need that stuff. We need it available now, and it's just heart wrenching when someone tells you, "Oh, it'll be about 3 months."
Yeah, and we're gonna have things fall through the cracks.
Yeah.
Our unemployment systems aren't working. We don't have enough staff people to deal with all of the unemployment applications.
Yeah.
Our nursing home systems are falling apart. Our economies are crumbling. I mean, all of these things are all happening simultaneously. It's too much for any one human to process, to deal with. So I want to acknowledge that. I want to start today's show by talking about the fact that we need to be patient and kind with ourselves, and it needs to be said that we are going through a shared trauma. I mean, I've talked about the fact that that this is traumatizing, that just experiencing the pandemic is traumatizing, and that you have to do self-care, but I want to remind people of that. I want to acknowledge that being a survivor in this pandemic and living through this pandemic is trauma. You're experiencing trauma, and how your body physically deals with trauma is going to come out. It's already happening. Some people are going a little COVID crazy, right? You see these different things that are coming out in the people around you. Maybe as I talk about this, you'll be able to identify some of the things that you're seeing and that you're hearing from other people. This is also why I think it's very important to spend a part of your day, maybe just 30 minutes every day, contacting a group of people. Maybe you don't contact all the same people the same day, but I checked in with my brother, who runs a taco truck here in Fargo, and I noticed that they're open for business again, and I had to contact him and go, "Hey, are you okay? Are you using really safe practices to ensure that you don't get sick? Because I mean, gosh, if the taco man gets sick, like that would be a huge blow to people's emotions right
Oh
now."
yeah. We don't want to talk about that.
No, we don't talk about that. So here are a few things from a trauma specialist, okay, that you need to be mindful of during this time. Part of your brain, when you experience trauma, in order for you to survive that and keep going and get through whatever this trauma is, parts of your brain shut down so that you can continue to function without being overwhelmed. So that's happening to your brain. Parts of your brain just shutting down. They're like, you don't need this right now, so just shut that down so that you can survive. As a result of your brain doing that, you're not processing everything that's happening to you right now. And you won't be able to process it until the trauma is done, until you actually have. So really, until this pandemic is over. We're not going to be we're just shoving it out of our brain, turning parts of our brains off so that we can keep going. And so you're not processing things, your brain is not processing things properly right now. You might feel either detached, numb, out of touch with your own emotions, And in feeling that way, if you're acknowledging this, if you're hearing me and you're like, yeah, I kind of have felt like that. That's happened to me. Has that happened to you guys? Where you feel like one moment you're just like detached, numb, you'll feel nothing. And other times your emotions are all out of whack, especially if you've had trauma before. These things can happen. They can trigger this reaction in you. If that's happening to you, it's totally normal. It means everything's working properly in your body. It's totally normal. What that does, however, is in some people, that makes them hyper vigilant. They're constantly looking out for where's the bad thing going to be?
Yeah.
And I'm going to be ready for it, And while other people get depressed or hypoactive. So you might have somebody that's hypervigilant, anxious, other people that get depressed and just really lethargic, hypoactive. None of these things means that there's anything wrong with you. It just indicates the predisposition of you personally into how you deal with extreme stress. How you deal with extreme stress might be you get depressed. How you deal with extreme stress means you might be on pins and needles at all times. That's just how your body deals with it. In-depth processing of this trauma you're experiencing right now is not going to happen for years. For years. When you're ready to deal with it, when it's safe for you to deal with it, that's when it's going to happen for you individually. So, in the midst of this trauma, just getting by emotionally, functionally, totally okay to be that way right now. You have to have patience and kindness for yourself. Lower your expectations. Be kind to yourself and others. This is vital to remember right now. Let's go to our numbers.
All right.
Start off with our world numbers. We are far over the mark of 2 million now. We are actually at 2,561,044 cases of COVID that is positive throughout the world. Total deaths are now at 176,984 worldwide. In tests conducted, we are over 4,155,178. We still need to ramp that up quite a bit. And if we look at the U.S. numbers right now, if you take a look at the U.S. numbers, you'll find We currently have 818,366 cases, 45,296 deaths, 82,860 recovered. And this very interesting thing here, I wanted to show you the new CDC guidelines that they posted on World Meter. This is the World Meter site, and they posted this, which is new, onto their site, and it says that this is in accordance to new CDC guidelines. The reporting for different states is different.
Yeah.
And for New York, the numbers shown will include probable deaths and consequently probable cases for the same number, as reported by New York City. Maryland also includes probable deaths, as reported by the Department of Health. Section COVID-19 statistics in Maryland. Wyoming includes probable cases, as reported by the Department of Health. Most states report and dashboard, such as Texas, Pennsylvania, North Carolina, Missouri, etc., and they lag behind or show incomplete data with respect to the data shown by individual counties on their official websites and dashboards, which is what is collected by World Meter and then aggregated when possible to show the most updated and accurate numbers in the tables for each state, which I'm about to show you where the states are. They will soon publish state-level pages with graphs and breakdowns by county.
Okay.
So as it stands right now, these numbers added with those CDC guidelines show that New York has 256,555 cases. It's over 250,000 cases, and now we are learning that this includes probable COVID deaths, which kind of bothers me a little bit because what that's implying, of course, is that they're not able to test them and find out before they die. That people are dying without us knowing for sure. We're just assuming at this point that they had COVID and they're getting put on the list. That's 764 new deaths for New York. New Jersey has 92,000. Massachusetts is up to 41,000. California is at 35,000. Pennsylvania is at 35. Illinois is at 33. Michigan is at 32. Florida is at 27. Folks, these numbers are still climbing. And this is really a horrible and dangerous disease. You do not want to get it. You do not want to put yourself in a position where you're having to deal with it. How are we doing closer to home?
Well, in Minnesota, we have 2,356 confirmed cases, 1,160 people recovered, and 134 people have died in Minnesota. And on the county level, our local county is Clay County, the one we live in. We're up to 62 cases. This was only 30 a week ago. So we've doubled in case numbers. And we're a small county. You know, there's not that many people here. So when I know there's 62 people kind of in my neighborhood that have this, and there's been 3 deaths. So that's very, very unfortunate. So it's rising. Now in North Dakota has 585 confirmed cases, 189 recovered, and 10 deaths. And from the county standpoint, I look at Cass County because that's the largest city in North Dakota is Fargo, and there's 246 cases. So it's about half of the cases in the whole state are in our neighborhood too, and they went up 10 in just the past day, and there's been no new deaths since 2 days ago, but these numbers keep on going up and just keep on going up.
Meanwhile, we have people asking for the stopping of the madness. Did you get to North Dakota cases too? Yes.
Yeah, just did.
North Dakota still protesting, by the way.
Oh, yeah.
Yet today, protests continue countrywide. And let me just share with you this post saying that, look at the dates here, okay? Top one shows a man named John W. McDaniel saying that on March 15th, if what I'm hearing is true, that DeWine has ordered all bars and restaurants closed, I say BS. He doesn't have the authority. If you're paranoid about getting sick, just don't go out. You shouldn't keep those of us from living our lives. The madness has to stop. Echoing the voices of many of the protesters out today. On April 15th, this same person was in the Marion Star saying, according to the newspaper, Ohio health officials confirmed Thursday that John W. McDonald, age 60 of Marion, died at 1:34 p.m. Wednesday, April 15 at Riverside Methodist Hospital in Columbus. He was receiving treatment for COVID-19 virus at Riverside, when he passed away.
Well, so a month later, within a month.
I need to remind folks that you are not immune to this disease. Now, let me show you what kinds of signs people were carrying. Here are some of the signs people were carrying. I need a haircut. I want a haircut. Massages are essential. Let my people golf.
Oh, my God.
Give me liberty. Give me death. Get used to our teeth being... Let us get our teeth cleaned. Don't cancel my golf season. Lots of I need haircuts.
Yeah.
I saw a woman parting the part on her hair, showing people how she needs to get her hair colored.
Hair color, yeah.
And I want to acknowledge people's grief, people's trauma right now. Okay? I want to remember to acknowledge people's grief and people's trauma right now. At the same time, this is a little crazy. Look at these people.
Yeah, this is in front of the North Dakota State Capitol, in fact. And these two women have what looks like they took a mask and cut it out so their faces or noses and mouths are exposed through the mask and just have an outline of a mask. And I'm looking at this going, so they're protesting having to wear a mask.
They're damaging usable masks that right now our healthcare workers are clamoring for, that people need in order to keep themselves safe, and they're mocking the idea of safety and saying, safety be damned. I'm going to destroy gear, safety gear, in order to protest the idea that I should have some government paternalistically telling me whether or not I can put my life at risk. I want to put my life at risk. Hey, if I'm allowed to do drugs or drink alcohol to oblivion, why can't I go and subject myself to the pandemic and, let the cards fall wherever they may?
Yeah, and, people, the governors are feeling the pressure from the economic, hardship. They're going to start opening up all sorts of places of business.
Well, some places never even closed down.
Yeah, and a lot of places haven't even shut down. Some shut down because they had 240 cases or 130 cases, like in Grand Forks, in that place that makes the propeller, the windmill parts, And they have over 400 people that had to go home. They were continually working, and yet the virus spread around to hundreds of people, and they're closed down now because they have an epidemic in their place of business. They're spraying the whole thing down. They're going to bring people back to work. Same thing's going to happen. The bars have been closed. If they open the bars, we're going to have people in close proximity because the bars won't make any money if you only have 12 people in there at a time. Luckily it's getting warm outside, so if people have to stand outside in lines. But in Wisconsin, during the voting thing we aired, 6 people have become ill from going out to vote. Something that was totally not necessary to do because it was a primary. Didn't mean anything, and these people went out to vote, and they had all the distancing and stuff, but it didn't work for 6 people, and there's going to probably be more.
So even as you're seeing people that are going out and protesting and, joining in these car processions and honking their horns and destroying masks and all of that, I think you need to reach out to people and talk to them and tell them to preserve their lives. Yeah. Sometimes people need to hear that their lives are significant and worth fighting for and that they matter. Your family member, your brother, your sister, your uncle, your cousin, your friend, your neighbor, they need to hear that. They need someone to tell them, what, your life is valuable. Don't play with it. Don't give up the ghost. Don't just play Russian roulette with your safety, with your health. Do something to fight for yourself. I need you around. Your kids need you around. Your friends, your neighbors, your community needs you. Remind folks that their lives have value, and tell them to fight. Tell them to fight like heck, because I think it matters. I think it makes a difference. Even when you're talking to a family member that might be a little stubborn, that even when you're talking to family members that are not the best at listening or taking direction, I think it's worth it. It's worth it to have that conversation, even if it's somewhat uncomfortable. You might just be changing someone's mind and saving someone's life. You might just be.
Yeah.
So think about it. And I wanted to share with you this tweet from President Trump saying that in light of the attack from the invisible enemy, as well as our need to protect the jobs of our great American citizens, I will be signing an executive order to temporarily suspend immigration into the United States. Now, here's something that Tori says, posted, writing in her message, buckle up. Pompeo, that's Mike Pompeo, has recalled all U.S. citizens. The ambassador to the United States in Mexico also did so several weeks ago. Mm-hmm. And it's true what Tori says here. That happens during war. When people are recalled, it says now we shut down our borders completely. The president has announced that. She goes on to say this is a war. China took NOCO via Rocket Man to solidify Oriental Bloc. I don't know if we're truly at war, but it is true that when we recall all U.S. American citizens, it is usually because there is a war. Mm-hmm. Something bad has just happening. And speaking of something bad, take a look at the story about Kim Jong-un. Apparently, and there's conflicting reports. Mm-hmm. I've seen a lot of reports saying that he is in coma. He's brain dead, essentially. I have not been able to confirm those things. I'm sure that their government there is trying to keep things under wraps. But North Korean leader Kim Jong-un is in grave danger after possible heart surgery, reports say. So there's not a lot of details on this, but it can have huge implications, especially for that area of the world, for this man to this vacuum of
a dictator
power.
dies. Yes, what happens then?
Oh, I hear his sister's in line in succession.
Oh, okay. All
right. Somebody commented that Oregon has protests at their state capitol right now. So this continues all over the place. Libby mentions that she thinks that we're going to go into war, but not against the virus. I think the war will be with China, and Russia is on the horizon. Really? Wow. Well, the fact that we're closing down our borders and stuff is definitely concerning. Yeah. I will tell you that people that are part of the smuggling operation, the big billion-dollar business that I've been covering for years now, they're really upset. There are a lot of different fights going on, people getting fired, people throwing each other under the bus. Bartolo Fuentes, one of the people accused of drumming up people for the caravans in Honduras, posted this picture from their social media, and it is a COVID virus inside of a cage with a kid. And the cage is labeled shelters for migrants in the U.S., children's shelters in the U.S. First of all, I don't think we even have children's shelters. There was one at Tornillo that was temporary and it's been closed. And the child is screaming, "Please help me." And the COVID virus is licking its lips and holding a fork because it's going to eat the little kid. And in front of the cage with his back turned to the child screaming for help is President Trump with his eyes closed, looking away, pretending there's nothing going on.
Wow.
This is meant to elicit the same kind of anger and fear as the kids in the cages first affected Americans. Remember when we heard that? When was it ProPublica or some other publication like that leaked this audio, and
Oh, yeah.
we heard the children crying, and we
yeah.
saw the pictures of children in the cages. People went nuts.
Mm-hmm.
They're trying to elicit that because what they want, what they desperately need, is for the president or for some authority, some human rights group, to reopen them for business, to allow them to continue to do business. While during this pandemic, most shelters, most of the places that are part of this chain, this underground railroad of smuggling, if you will, have been shut down. They've been completely shut down by this pandemic. Minority Humanitarian Foundation is also very upset with this development. They are posting about how Trump claims that he will temporarily suspend immigration into the U.S. due to coronavirus fears with this post. It says, in a stunning display of opportunism, racism, and nationalism, the President of the United States has announced that he will be signing in an executive order temporarily suspending immigration to the United States. I was torn on whether to share this news story or not, as this source is completely unreliable.
CNN.
However, I am doing so in the interest of providing you with the important immigration news. We can all probably agree that in any pre-Trump administration, this would be a top news story. Now, why does Minority Humanitarian Foundation, which runs shelters in Mexico, which has a very complicated supply chain of movement of people through the country, flying them across the country, sending people back home, quote unquote, to be reunited with their family members? Well, because it's part of their business, and their business is shut down.
Yeah. They can't do the smuggling that they've been doing or raising all the money. People aren't going to give any money for them to smuggle kids and smuggle families into this country, because they're not going to be able to freely cross that border and to do the things they've been doing this whole time. So they're really angry about their money getting cut off. The stuff they've been working on for this, this past year, and they've been very lucrative at it and have done so much damage to the policies and all sorts of things in this country. And they're stopped. They're stopped.
And I find it's so hypocritical, because I've told you, a lot of these folks are paid actors. I didn't say they're good actors, but they're definitely paid actors. And they, they put on a lot of theatrics to gain your sympathy. A lot of these things are staged. And I didn't even believe that myself when I first started reporting on this 4 years ago or longer. But it was obvious. It became very, very clear to me. I've witnessed it. And I had to see that. I had to experience that to see through the hypocrisy. People like Digital Smoke Signals and Myron Dewey were involved in doing all of this messaging around protecting the sacred. And they turned out to be these frauds. Here's his latest post where he says that from being so-called illegal on their own homelands to being essential workers, think on that. Think on what it's like to be afraid to go to work, but being more afraid not to go to work because if you don't work, your children won't eat. Our relatives are also suffering. Relatives? That's rich. This is the guy who said I wasn't Mexican, I wasn't an indigenous person, that I can't speak. Don't listen to that woman. Don't listen to this woman because she can't speak for indigenous people. He conveniently has now adopted Mexicans as relatives since his tribes and other people involved in the Border Support Network began to work with the smugglers. So now it's convenient to say Mexicans, Central Americans, people that are brown like him, they're his relatives now. They weren't his relatives when I was exposing the criminal behavior of the people that were at Standing Rock, like himself. We weren't relatives then. I was just some white person to him that didn't have an opinion to share. They didn't have any authority to speak. But now he calls us relatives. Folks, these people are hypocrites, is what they are. That's what they are. Let me show you this illegal stimulus. And you're going to hear AOC. You're going to hear a lot of people, Minority Humanitarian Foundation, Border Support Network, Connected People saying, we need money to keep the folks that are here undocumented and waiting for their asylum hearings, for them to be able to make rent, for them to be able to pay their bills. Because we brought them here. They put them in the detention facilities. We got them into sponsored homes, but now they can't make rent. Nobody's working. So you're going to have to pay for it. You, the American people, why don't you fork over some money so that they can have something? And this is, news that is all over. In Dallas, the Dallas Morning News published a story talking about how millions of U.S. citizens won't get help from stimulus checks because their spouses or their parents are unauthorized immigrants. Now, if you are a child, a U.S. citizen in this country, can you not apply through the IRS paperwork, Duke, to get your stimulus money?
Not
if you're a U.S. citizen?
Yes, if you're a U.S. citizen, but not a child. If you're a U.S. citizen, you can, and you haven't even filed taxes. You just have to, tell them your date of birth. You have to have a social security number, and a bank account. And you basically file a form on the IRS website. So you're not barred, because I'm not quite clear about the citizenship status. So
okay,
I don't really know on that. I haven't actually seen it in the IRS stuff. I've read through a lot of it, and I read through it every day because things are being reinterpreted and redone. There's a lot of people who aren't getting their stimulus checks. There's a lot of messy things going on that haven't worked very well with this. So I don't have all the details on that, but I know that there's a way to file when you've never filed taxes.
Mm-hmm. Well, let me tell you that we have all sorts of different programs and nonprofit organizations and all sorts of different programs where people in America are stepping up to make sure that nobody goes hungry and that people are cared for. And we're lucky. We're very fortunate to live in a country with those kinds of resources. Mm-hmm. Meanwhile, in Mexico, they're not doing so good. In fact, the Gulf Cartel has been distributing food supplies. They're called pantries. Here's a picture of the boxes that they're distributing in Mexico with the logo of the drug cartel.
Really?
The drug cartel of the Gulf. Yes, the CJNG, which stands for Cartel Juventud Nueva Generación del Golfo. That is the NJNG and CJNG Gulf Cartel, and they put their logo on the boxes.
Wow.
And they're distributing these boxes, and the president is mad. Imagine how horrible his government looks, right? With the drug cartels delivering food to people and aid and support to people at a time when the Mexican government is looking like they got caught with their pants down. Mm-hmm. They don't have the adequate amount of supplies, support, financial, etc., to help people get through this pandemic. They're not really offering folks what they need to get through this pandemic. And so this is the result. You have the cartels out there doing humanitarian aid work. Bizarro. Can it get more bizarre?
Yeah.
Well, for your moment of levity, I'm going to show you something that is even more bizarre. Here is, and I'm not sure what Latin American country this is. I think this might be in Mexico. It looks like it is somewhere in Mexico. They are running loudspeakers. Loudspeakers. If you don't separate 2 meters apart, we're going to shoot you with the water cannon to separate you. Keep a distance. This is your last warning. They are ready to shoot you with water. And attention. Warning. If you don't separate 2 meters in distance, we will shoot you with a cannon of water. And a firefighter on the top with a water hose out. They are ready to shoot you with the water cannon.
Oh my God.
That's what's going on in Mexico. Woo! So they are not messing around. You either respect the authority or they're going to hose you down in the streets. That's what's going on. Folks, I hope that you self-care, wash your hands, call a friend, check on them, make sure that they are well. God bless and have a great evening. This has been your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
On 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Goodbye and good night.